So vein selection is a big thing. A lot of times the veins are going to be larger in the dominant hand because you use that more. But most people, that's the right hand or left-handed, but whatever, they're going to be using that arm the most too. So that might be a bad spot too because they're moving it, knocking the IV around. It's just, just depends on where you can find the best vein at. So to check for the best vein, I always put a tourniquet on. And simply look. And a lot of times on these mannequins, you just look at where all the sticks are. But that's not the same on a person. If you have a drug-abusing person, their veins are all splurged and whatnot from all the sticks. So it's more difficult on them, not easier, like this mannequin. So we are going to try something on the forearm. Now, a lot of people always say, well, those phlebotomists don't have trouble getting my blood. I'm like, well, they're just sticking you one time. They're not trying to place a straw down in there to keep it there. I said, this is more difficult than just a phlebotomy. So I've got my veins selected that I want to stick. Now I need to clean that side up. Now this comes with gloves, so I guess I could take these off and put these on. Our kits at VA don't have gloves in them. So that's handy. So you'd have your own little sterile gloves here. So this is a little betadine. And I got some tape here. When I tape my IVs, I like to use the silk tape. They don't want us to be sticking these on the beds anymore, so I just stick it on their finger and say, hey, hold that for me for a minute. And generally, people don't mind. Now, I've started IVs on confused patients that I had to have 2 or 3 people holding them. I've started IVs on people in 4-way leather restraints. That's always exciting to not stick yourself with that stuff. So, starting IVs can be kind of scary too. In your kit, you've also got these other types of needles. There's the, like I said, there are the Insights. And there are also these, I don't even know what these are called, but I used to have these when I was in the Navy. But it's like the old-fashioned kind before HIV that do not retract. The Insight, when you stick the person, it has a little button, and you click that button and the needle sucks up into the holder, where this doesn't have a holder. So these are the kind we used to use. And I'm just going to use this so that I don't waste this for the sim lab, so that one of you guys can use it if you need to. So we are ready to roll now. I'm going to let his arm breathe for a minute while I'm getting my stuff ready. I saw where I wanted to stick, so I'm going to, if that's my policy, crack this. We're not going to put betadine on the mannequin because they'll discolor them. But on a patient, first of all, I would ask them if they have any allergies to iodine or shellfish. If not, I would crack this, start in the middle where I want to stick, circular, working my way out into a bigger circle, cleaning more area, and then I would discard this in the trash. Now I've also got these alcohol pads. I'm going to give that a minute to dry, and then I would rip open one of these alcohol pads and just dab the middle where I was going to stick so I can see my vein better, and then discard that in the trash. Now when I go to put my tourniquet back on, I'm not going to want to be reaching over my area. I kind of want to keep away from my area. I also don't want the ends of my tourniquet to flop around and hit that area also. Now my patients, alert and orient, they're going to hold still for you because they want you just to have to do this one time. Now these also have the gauges on them. This is a 22 gauge by 1 inch long. So some places don't want you to do anything, like the VA says nothing smaller than a 20. It just depends on your unit, your unit policy. So I'm going to crack it. Now, I'm going to just show you this, just so you'll know. Normally, I just kind of, give it a little crack, just so that it'll make sure it'll slide, but I just want you to see this. This is a hard needle. This is flimsy plastic, kind of like the plastic of a straw. So that's what we're dealing with. Hey, we talked about recapping, right? Just want to be sure. Okay, so we are ready to roll now. So I have it. I'm going to just kind of pop it a little bit. Now I'm ready to go. Now this thing has a little bevel. When you look at it, it's in your book. Look up bevel. We want the bevel to be up. So I'm going to look at this and make sure my bevel's going to be up. And sometimes if your eyes are bad, you better make sure you take your bifocals to work. And now we're ready to go. So I've got my area. I'm not going to touch where I did all my cleaning, but on either side, I like to just kind of stretch a little bit to hold the vein in place, bevel up, and I'm going to stick. I'm going to say, sir, we're going to stick on 3. 1, 2, 3, and I'm going to stick. There's a certain angle you want to be at. I'm going to make sure I'm at that angle. And as soon as I see blood come back, I'm going to stop pushing the needle in. And I'm going to just insert the blue hub over. I'm going to insert the hub all the way down. And then I'm going to put a little pressure about 1 inch down the line, because this is an 1-inch-long needle. I'm going to pull this out. Now I've got a sharps here. Generally I'm going to be starting this alone. If my patient's alerting oriented times 3, I don't need help. So I'm going to set this over on the table, knowing I've got to throw it away in the sharps at the very first opportunity. Pop my tourniquet. Now blood may be dripping, maybe not, because I have pressure here. But if it's dripping, I don't care. So then I'm going to grab my sterile end. That's what I'm going to plug in. And I'm going to plug it in. Screw it on. So now I can get my tape and secure my IV with tape. Now my patient's alert and oriented, so they're going to hold still once again, because they sure don't want to make me have to do this twice. Okay. A lot of people say it's really difficult with gloves. Now it's just got to be more difficult, because I'm not going to take a chance on getting contaminated with something that these patients have. And gloves work both ways. They're to protect you from the patient, but they're also to protect the patient from you. So, tape it all down. Now when you're practicing, don't use this in your practice, because you're going to need it for your check-off. Because for check-off, we want you to do the whole thing. And pull that off. Stick it on. And by check-off, I think I mean the final check-off. So when you're checking off with us, just for the first check-off, I don't think you need, I think you can just tell us you're going to slap that on there. But for the final check-off, if you draw this, we're going to want you to stack up. Now you got to tell us what you're going to put on here. We're going to put the date, the time, the gauge, and your initials. And the last thing we're going to do is we're going to peel this off, because this is like a window frame, so that the plastic will go on right. And on this half is where you're going to write that. So you can carry it right to here. You're done with all the bloody stuff you got to do, and you can write on it. Then the last thing you do is you take this and you rip the backing off and you put it over the plastic part so that we know all of our information. You can start an IV. Another thing you can do is, now that we're all done, you don't want this needle laying over here. We got it all taped and secured, because that's the most important thing, having your IV line secure. Then I'm going to carry this. Now I don't want to just be walking like this because I could stab somebody. A lot of people laugh at me, but I don't care because I've been stuck with a needle from somebody carrying it like this. I carry it up like this and I say, hey, it's the Statue of Liberty. And then I'll walk over to my sharps container, open it, lock it in. A lot of times your sharp container won't be white, it'll be red. So now I need to hook up my IV line. So now is the easy part. I would simply grab an alcohol pad, rip it open, clean the end of my IV line, take the cap off of my IV tubing, plug that in. Now this thing's kind of dangling around. A lot of times I like to put an extra piece of tape on just, to keep it a little more secure because I'm always afraid of this thing getting ripped out. Sometimes I'll even put another piece on. So there we go. We're all taped up, held secure. Now I could prime, or my tubing's all primed, plug to the patient. I can type in the numbers I need and get it running. I think that's about it. Clean up my area, get rid of all my debris. Voila! It's that easy.